Hello, my beautiful train wrecks. This is Jill.
And me.
Who is me?
You.
Tom. And this is Diamond Painting with the Edwards. We are a beautiful train wreck. And this is how this one's going to be today. I can tell you now. Because I'm tired. And this is like my third video of the day. This is our very first WIP and chat for an event we're having, or we're participating in. We're not having it, but we're participating. Yes, I am participating in another event. The event is hashtag Passionate in Purple 24. It's hosted by Diamonds by Teeda, Teeda. And I am calling this Purple Butterfly Purple Eyed Lady because it didn't have a name. And there's two things about it that's really cool. And that is a butterfly and a lady with purple eyes. So we're just running with that. The name might change a lot, but hashtag Passionate in Purple 24 will remain the same. If you've not followed our Facebook group or main page, links will be down below. We also have stickers. That link is going to be down below. If you have not gotten our stickers yet, what are you waiting for? We're not going to keep your information. As soon as I fill out your card, I erase the address. So no, we are not going to be absolutely crazy and send you wild and crazy stuff without you asking for wild and crazy stuff. Going to use Bella Art trays, the small one and the big one today. Maybe only the big one, because we're only going to be using one color today. Of course, the right side is all a black. So we are going to be doing color blocking today. Got a brand new pin for the month of May. Isn't it pretty? The top is a glue dot. This is purple wax that came with, yay, can you see? I don't know. Came with it. And these are like rose gold colored. They're really pretty tips. I usually just get silver. Yes. So we have all of that. And I want to thank Crafty ishKristyn. I got another peepee. Little crafty peep. Look at her. Philip will get that. Look, she's on a donut, drinking what looks like a brownish cola. Isn't she beautiful? So she is going to go up above with the other crafty ishKristyn peepee little peepee thing. I don't know. Do you have to go to the bathroom yet? I don't know. But yes. Yay. So that'll go on the board. And then Tom got a set of stickers from her. So his board will have some lovely Kristen peep stickers. So yeah. Pippi. His name is Pippi. Pippi. The peep. I was sitting there trying to figure out what it was called. My brain is not working today, boys and girls. It's out for vacation. It's been a long weekend. The editor had the best weekend. So, in a previous video, I did an unboxing for storage. I was able to put all number 5s into one pot, and there was like 5 bags. So, it's been forever since I've done squares. I've not practiced. And I'm filming. This might be a train wreck. I've never used squares in this tray. Don't know how it's going to be, but I've seen other people use squares in the Bella Art tray. Oh, they're not coming to take me away. So we're going to see how this goes, because I've never used them with squares. Okay. I think I put too many in. But that's all right. It's not bad. Okay. So, this month is many different months. There is mental health awareness this month, and also fibromyalgia. See, look how pretty that. Fibromyalgia. Ugh. Fibromyalgia awareness month as well. And I was very disappointed because there was really nothing in fibromyalgia. But Mr. Joe Cole, can you write his name down? Joe Cole, write his name down. And I will put his channel, because he has a site as well. So I will put that down. Yeah. So he is going to make me some tester fibromyalgia. So canvases. So yeah, I'm excited. Get to be his guinea pig. Thank you. I'm not. I'm glad it's all 5, so I can't mess it up. Okay, so
And I'm ready to go to bed.
not yet. So as promised in a previous video, I wanted to use May as an awareness for fibromyalgia. So I have Tom to help me talk about it in case you're not aware of it. So Tom, make sure you note down where you're getting this from, and you can begin.
Alrighty then.
What is fibromyalgia?
Fibromyalgia is a disorder characterized by the widespread of the musculoskeletal pain.
Yeah, muscular skeletal.
Accompanied by fatigue, sleep, memory, and mood issues. But it also, a lot of people believe that it amplifies painful sensations by affecting the way your brain and your spinal cord process pain and non-pain signals.
Yeah. Where are you getting this information?
This is coming from the Mayo Clinic.
Okay. Okay.
Symptoms often begin after an event such as like trauma, physical trauma, surgery, an infection, a significant psychological stress.
Yeah.
In some cases, symptoms gradually accumulate over time with no single triggering event whatsoever.
Yeah. Sometimes you can just be born with it.
Yep. Women are more likely to develop fibromyalgia than are men.
Yeah.
Many people who have fibromyalgia have tension headaches. I'm not even going to try to.
What is it?
It's that long word right there.
Okay, that's TMJ. Temporal mandibular joint. TMJ. Our jaws hurt.
Okay,
And I have that, and it's very painful.
IBS.
Yes.
Anxiety and depression.
Yes. Yeah, I got all those.
I got 2 of those.
I've got all of those.
I got 2 of those.
Yep, I've got all of those so far.
While there is no cure for fibro, a variety of medications can help symptoms.
Yes.
And they say exercise, relaxation, stress reduction measures also may help.
Yes.
But
this is a new glue dot, so I'm just kind of rubbing it on my hand to kind of get it to stop being so sticky.
But what they don't tell you, you can only reach a certain limit of pain medication before you max out.
Not pain medicine, but just medicine in general.
Well,
because I don't take pain medicine.
You can only take so much.
Yes, and I'm at that level. I'm done. Nothing else they can do.
So, like some of your symptoms,
they can be treated with over-the-counter stuff. It's like there's not just one medicine that takes care of all of it. They kind of do different medicines to help with each side effect. That's the best way to explain that. Keep on going, sir. You're doing great.
Some of your symptoms could be widespread pain, which could be like a consistent dull ache that has lasted for at least 3 months. The pain must occur on both sides of your body and above and below your waist.
Yes, the quadrants.
To be considered widespread pain.
Yeah, you get quadrant pain. That's delightful. And they're never at the same time. You know, you never know from moment to moment what's going to hurt the next day.
Yeah, bad thing would be between my shoulders and my knees. I mean, in my lower back, yeah. I'm not saying I have it or not, but I'm just throwing it out there.
You've never been diagnosed yet.
Nope. Another thing with fibro, fatigue.
Yes.
You wake up tired.
Yes. You go to bed tired.
You can sleep for long periods of time.
Yeah. 12 hours is usually my max.
Your sleep is often disrupted by pain. You could have sleep disorders.
I do.
Restless legs syndrome, sleep apnea.
Yes. I was diagnosed with 7 different sleep disorders. Fun me.
So, I mean, that's... And then, like, your cognitive difficulties, a lot of times referred as fibro fog.
Yeah.
It impairs ability to focus, pay attention, and concentrate on mental tasks.
Yeah.
Like speech.
And we already know I cannot speak some days, today being the day.
Yeah, your speech can be very hard to use simple words.
Yeah.
So, I mean, or just thinking sometimes.
Yeah. Sometimes people have to talk for me. I get stuck, and then I know what I'm trying to say, but I can't say it, and they give me time to think, and then if they don't, they have to help me.
Yep. And it also coexists with things like IBS, which is irritable bowel syndrome.
If anybody out there does have IBS, are you IBS-C? Are you lucky enough to have IBS-D? Because IBS-D is IBS diarrhea. And then there's IBS constipation. And I know this is a TMI moment, but with medicine, sometimes I only go to the potty 1 time a week. And I do have colonoscopies every 2 years. It's just my belly. Okay, keep on going. That was a TMI moment brought to you by Jill. But you know, hey, if you're going to talk about it, you gotta just talk about it all. Okay, go for it, sir.
But besides that, you got the chronic fatigue syndrome.
Yeah.
Migraine and other types of headaches.
Oh my goodness, yeah. Okay, let me see. I have to move my glue dot anyway.
That one. My phone can go so far.
Interstitial interstitial cystitis or painful bladder syndrome. Let's talk about this. There's this thing called a camel. And on good days, I'm a camel. Um, I may go to the potty every 2 or 3 hours. But then there's camel days when I may only go a couple times a day. And we call that camel because I can go all day without using the bathroom. Yeah, because sometimes the nerve endings don't trigger the you got a potty reflex. Okay, keep on going. I'm just kind of like tidbitting you as he's reading on some of the things I go through. So you have the book diagnosis, and then you also have real life things that happen. That's what I'm doing. Go forth, conquer. You're doing great.
So the next one is the TMJ disorder. I'm not reading that one.
Okay, all right. TMJ. It started out like I had tooth pain, right side of my teeth. And I'm like, oh, do I have a cavity? It was the bottom canine. And I went to the dentist, and like, we don't see anything wrong. We don't see anything wrong. So, after years, I finally got a doctor to listen to me and gave me medication for it. And what it is, it's the transgenial nerve.
The temporal.
Yeah, the transgenial.
Mandibular.
Yeah, it's TMJ. But it's a transgenial nerve. I can never say it either. And it goes across your face. Say like your eyes are here, and then your nose, and then your mouth. It comes down from your head, and it can shoot across your eyes. It can shoot across your nose, and it can shoot across your jaw. I have had it shoot across my eye, and I could not see. Things went very blurry with my glasses on, and even some of it was darkened. That was a very scary moment. And then I've had it hit my upper lip, and then I've had it go up into the bottom of my jaw. So they gave me a medication, and finally that solved it. But what was very scary is we were on our way to a store, and I said, Tom, I can't see right. So, yes, it's very scary, and it can happen. And there's really no rhyme or reason for it other than it's a fibro thing. Other people who don't have it, fibromyalgia, get this. But in my instance, it's just a fibro thing. That's how we have to explain it. Okay, keep going.
Sorry, coughing fit.
Yeah.
I hate those.
So, yes.
But you get anxiety, depression.
Oh, boy, do you ever. And you get the anxiety of, I don't even want to get out of my bed. I don't want to leave my bedroom. I don't want to leave the house. I don't want to go outside. I don't want to go to the store. It's like different stages of anxiety. And I have gone a month without going to the store. I've gone a month without peopling anybody. That's just the anxiety. It's real, folks. Okay. Depression, yes. I am not afraid to admit I have depression, and I suffer greatly with it at time to time. Thank goodness it is not all at once. Okay.
You're lucky.
It's not all at once. I do have times of great joy. But there are more times than not I struggle. And I'm on medicine for it. Don't be afraid to get help. Don't be afraid. And this is also Mental Health Awareness Month, too. Don't be afraid.
Not to throw.
Get help.
I could not find anything
Nothing.
for mental health awareness diamond paintings.
Nope. Very little.
About that.
Yeah, it's kind of like certain things don't want to be discussed because maybe they're bad. And, oh, let's
Everybody
not
talks
do
about it,
that.
blah, da, 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 but when it comes
Yeah,
important, there's nothing out there
there's
for it.
nothing. No.
I mean, I found pens and shirts and
But not in the diamond art community.
yeah,
It's really
nothing
sad. Okay.
Then you have your postural tachycardia syndrome.
Oh, that is fun. Let's talk about this, boys and girls, because this sucks. What? And I've not been officially diagnosed with it because in the process of changing doctors and hospitals, I never stayed long enough at the other doctor for her to officially diagnose it. And luckily, okay, when I started having it, I had an enlarged heart. And I was having phantom chest pains, which you do. And I started having tachycardial issues. And when okay, it's weird. I can have a normal blood pressure and my pulse be high like someone is exercised for an hour. It's very scary. And I don't know the link. There may not be. I just may be an unusual case. I'm starting to find out I'm very unusual on certain things. Doctors are intrigued when I tell them my problems. And it affects my blood sugars. So if I'm having tachycardial issues, I have blood sugar issues. Anybody else have it? I'm curious about it. But I was put on 2 beta blockers, which you're not supposed to do, and also high blood pressure medicine and cholesterol medicine all at the same time. So I had to be very careful, and I was watched under doctor's care very closely. And I lost 100 pounds, and by doing that, I actually healed that. Or I put it in remission. Better words to say is remission. I've had a couple issues, but usually I will take a deep breath, or I will cough, or I'll sit down a moment and just relax, and it goes away. And I'm currently on just cholesterol medicine. Everything else is gone. No beta blockers, no high blood pressure medicine. Losing the weight and doing pulmonary rehab got me healthy enough that I don't need that. But could that come back? Yes. I have to be very proactive on exercise and diet and weight loss, and yeah. It, as my tattoo says, it takes strength to be a badass. And fibromyalgia, you have to be a badass. Sorry for the cussing. It's just the truth. That's what my tattoo says. Okay, next, Tom.
Oh, is it my turn?
Yeah.
Okay.
I'm just gonna say a few things to kind of, give people hope that it's not all doom and gloom. You can get things under control. All right. We were around a lot of smoke yesterday between grilling and using the smoker, and yeah.
For me, that has nothing to do with this coughing fit I get.
Yeah, but I'm just saying it doesn't help it. So we were doing some things we probably shouldn't have done too much yesterday, but we tag teamed, and it was fabulous, and we did it.
I get this coughing fits even driving. It sucks.
Yeah. You probably have what I have. You're probably going to need a little pulmonary therapy, and you'll be good. Okay. Next.
So the causes. A lot of people believe that repeated nerve stimulation causes the brain and spinal cord of people with fibro to change.
I did the TENS machines, and I had gone to a guy he's now in Ohio, a little Korean guy that put the on the needles, put electronic pulse on it. Oh, that was not good. Was not good. For a couple days, I could barely move my legs. So I'm not able to do that. That my body don't like. But if you're having this, try it. Try everything. It may work, it may not work, but try. You never know until you try. So just try. Okay. Next.
This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain.
Yes.
In addition, the brain's the brain's pain receptors seems to develop a sort of memory of the pain and become sensitized, meaning they can overreact to pain and non-painful signals.
Yes.
There are likely many factors that lead to these changes, including genetics, because fibro tends to run in families.
Yeah.
There might be certain genetic mutations that may make you more susceptible. Yeah, I just butchered that word.
Susceptible.
To developing the disorder.
Yes.
Infections. Some illness appear to trigger or aggravate fibromyalgia.
Long COVID. Diabetes. Heart disease.
Physical or emotional events.
Yes. If it's stressful, man. And there are times, and I don't mean to hurt people's feelings, but there are times that I may be invited to something and my body says, over my dead body, and I don't mean to do it. It's not that I'm angry at you or mad at you. It's just sometimes my brain will say, move an inch and you're going to get it. Luckily, I've got really good friends and family that will say, okay, you're in pain. We know you're in pain. Come over. And even if you have to lie on the couch and just talk, we'll sit beside you. And they understand. So there are people, that places I can go that I'm understood, and I can go even if I feel bad. And it's wonderful. And you guys know who you are.
And it could be physical or emotional events.
Yes.
So it could be triggered by a physical event such as a car accident, prolonged psychological stress.
Yes.
That may also trigger the condition.
Yes.
Which.
Yes.
I've been in a lot of those. So, and with the infection, I don't know about genetics, but those two I've been involved with.
You need to go get tested then.
So.
He needs to go get tested if
the
it's.
infection on my lower leg that I told you about.
Yeah.
I've had that. I've had the COVID, and growing up as a race car driver or dirt racer and sports, there was a lot of physical, and there was some emotional things going there.
Yeah.
So I mean, yeah.
You need to go get looked at.
And then your risk factors.
Yes.
Fibro is more diagnosed more often than women than men.
Yeah.
I do know some men that have it.
And I wonder sometimes if they really have it, but being a man, they don't want to admit that they hurt and they just deal with it and never get diagnosed. Let me tell you, guys. You can have your pride. But if you're hurting that bad, you don't have to be big, bad, macho all the time. If it's affecting you, please please go get help. Because this can happen to men, women, children, and even babies. If any guys that are watching this think they have it, especially if they're in Indiana, they think they have it, but they are kind of about it. Just tell me. I'll go with you. I'll hold your hand, and I'll be proud. If you're out of Indiana and you're having this problem, message me, and I will do all I can to help you get the diagnosis you need to try to have some kind of life. That's the end of my whisper talk. Okay, Tom, keep going.
So some of your other disorders, like if you have osteoarthritis, which I believe I have,
Yes.
but not diagnosed. It was just a thought because of rheumatoid arthritis or
I
lupus.
have that. I have rheumatoid arthritis
You
in my
you may
spine.
be more likely to develop fibro.
I have it in my spine, in my fingers, and in my neck, and in my knees. Yes. And yeah, that's not fun. So if you think you may have anything, yes, go in. They're going to run blood tests, and they're going to try to go through all the checklists. Find a doctor that will listen to you. I've had many doctors that say, oh, you know, it's just this, or oh, it's just gas, or oh, it's just this, or you find a doctor that will listen to you. And when you find that doctor that will listen to you, life is so much better because there's things that you can do. As for lupus, no. So far, knock on wood, no lupus. Okay, keep going.
So there's only one more section.
Okay.
Complications.
Yes.
The pain, fatigue, and poor sleep quality
Yeah.
associated with fibromyalgia can interfere with your ability to function at home or on the job.
Yes.
The frustration of dealing with an often misunderstood condition also can result in depression and health-related anxiety.
Yes. Let me talk to you about sleep. We're going to break that down. Very first thing he said was sleep.
Mm-hmm.
I have taken, and when I mean everything, I mean everything. Over the counter, prescribed. I went through a really bad sleep problem, and I went to this doctor. And he said, okay, tell me what all you've taken. And I told him. And he went, I can't do anything else for you. Even your sleep is maxed out. So, yeah. I am to the point now where this might be a little scary to some people. And I don't mean to scare people, and I don't want people to worry about me because I'm not out for... I have never been one to want the attention. I'm the type of person that I'm thankful that I got it other than anybody else in my family having it. Because I am strong. I'm tough. And trust me, anybody can throw anything at me. All right, let's go. That's kind of mental attitude and the way that I handle things. I'm very strong. I wouldn't want anybody else to have this. Because it would literally break my heart knowing the problems and the pain that I have. I'm to the point now with my sleep. I sleep when my body says no more. Sometimes that can be 24 hours. They told me if it's longer than 48, I need to come in. But And then there's times I may only get 4 hours of sleep. There's time that I get 12 to 16 hours. I figure, and the doctor agrees, my body will give me what I need. So I listen to it. You have to learn to listen to your body. He told me if it goes more than, obviously, over 48 hours to come in, if it gets to the point that I'm not even getting 4 to 6 hours of sleep, I have to come in. Because that could mean other things, brain issues. So I pay attention. I have a little watch that shows me all my sleep, and I pay very close attention. If I get up every morning, Tom wakes me up to take my medicine at 6:30. He'll know. If I am asleep while taking it, he knows. I'm going right back to bed, and I might get up at 1 o'clock. If I'm awake and lively, I'm awake and lively. There's no rhyme or reason to the sleep, but there is sleep issues. There's no reason to hide the fact.
We do have 2 more.
Okay. There's no reason to hide the fact. It is what it is. It's your life. If you have fibromyalgia, you gotta make it the best that you can make it. As for next, what that you talked about, was it anxiety?
Something, I think so.
Because you read that last line.
I passed that page.
Okay. Anxiety is real, folks. There are times the anxiety is so bad, I don't even want to see Tom or my son, Philip. I am literally afraid of everyone. I have yet to have a problem with our cats. But there are times I just tell Tom, no, I can't. People today. And he knows it's not personal. And I have missed out on a lot of things with nieces and nephews because I just couldn't. And they understand. They understand what that is and what it means. And but I always want to have pictures and videos, and it's not that I don't want to be there. I want to see, I want to do, I want to be so much a part of their lives. It's just sometimes fibro makes it to where I just can't. And then that's where the depression comes in, because then I feel like, oh, am I a bad sister? Am I a bad aunt? And if you listen to what your brain says, it will. It will get you, man. And I have my moments where life is just hard. And I need to talk to somebody. And I'll call and say, hey, man, I'm having a hard day. That doesn't mean I give up altogether. I won't give up. I am like that frog in the frog in the pelican's mouth. And it's like, I never give up. I might be down, but I will never tap out. So, yeah. And everybody around me knows. And I have beautiful people, wonderful people that keep a very good eye on me. So, that's about that. Okay, next.
Okay, next is diagnosis.
Okay, diagnosis.
In the past, doctors would check 18 specific points on a person's body to see how many of them were painful when pressed firmly.
All 18.
Newer guidelines from the American College of
I have all 18.
Somethinology,
Okay.
RHEUMATO.
Rheumatoid. Let me see it. Rheumatology. College of Rheumatology.
Okay. Don't require the tender point exam.
No.
Instead, the main factor needed for a fibro diagnosis is widespread pain throughout your body, or for at least 3 months.
Yeah.
To meet the criteria, you must have pain in at least four of these 5 areas.
Yeah. And when they do the pressure test, it's not torture. They literally just, like, say my hand is they'll just literally go, does that hurt? Does that hurt? Does that hurt? Does that hurt? And, they'll go through all parts of your body, the 18 points. And let me tell you, they could have drained my blood and tested it for everything. That 18-point test? Ow. I would have rather them do complete blood workup on me than have to go through that 18-point. But I'm not trying to scare you. I just want to keep this real. If they touch you and it hurts, don't just blow it off. Get the help you need, because it's painful and medicines help. Okay.
So the left and the right upper region, because they're going to be the same, pain areas are going to be a shoulder, arm, or jaw.
Yes. And it can be painful.
And the lower regions are the same. The left and the right lower regions.
Yes.
Including the hip, buttock, or leg.
Yeah.
And then the axial region, which includes the neck, the back, the chest, or the abdominal.
Yeah.
Test. Your doctor may want to rule out other conditions that may have similar symptoms.
Yes.
Blood tests may include complete blood count.
Do I need to help you?
Yep.
Do I need to save you?
Yep.
Okay.
You might as well just read that whole lower half.
Okay. All right.
Because I'm having a hard
Complete
time speaking today.
Blood count. Erythrocyte sedimentation rate. Cystitic citrullonated peptide test.
I would have never got past that point.
Rheumatoid factor. Thyroid function test. Anti-nuclear antibody. Celiac serology. Vitamin D. That's those tests.
Whatever she just said.
And I butchered some of them because, I'm tired. And my mouth doesn't want to work, which is a big part of it. Okay. What was the last paragraph? I think you can read it.
The last paragraph is, if there's a chance that you may be suffering from sleep apnea, your doctor may recommend an overnight sleep study.
Yes.
I'm already there.
When I first did a sleep study, I have had many sleep studies. I probably had about 6 or 7 sleep studies. They did a home sleep study. It came back, it wasn't right. Go figure. So I had to do another home study. And they said, nope, you got to come in. Your sleep study is not right. Okay. So, sleep study 4. Went in. Did it. They're like, well, we're going to start you on a lower. Okay. Having trouble. I could not wear the mask. I said, nope, can't do it. Another sleep study to get it higher. I ended up with a 22. Most people are like 4 or 5. I was 22. A jet engine is required for me.
I think mine's 18.
Yours is 18. He's almost up there with me. This is why I think he needs a fibro test. Can anybody see my point?
I'll let you take control.
I think he needs it.
So.
But because he's done things that could mess up the neurological side of his body.
And there's a lot of times I just hurt.
Yes. And I look at him and I'm like, okay. So, is there any more?
Treatment.
Okay. I encourage everyone who is in pain a lot, who's shown any of these signs. There's no shame in this. There's no, oh no, how can I have to be perfect. No, you don't. Get the help you need. If you've got help and you know more symptoms is coming, don't say, oh, I don't want to have anything else wrong. I'm not going to go to the doctor. Get to the doctor. Help. Get help. There's no stigma to fibromyalgia. Please get the help you need. Okay. Treatment.
Yep, we got less than 15 minutes left.
Okay. Treatment.
Treatment. So, if it sounds like I'm reading this, I am off their website. I'm reading it because I don't want to mess it up.
Yeah.
So,
the website will be down below.
Yep, I've already got it written down. So,
yeah.
In general, treatments for fibro include both medication and self-care strategies.
Yes.
The emphasis is on minimizing symptoms and improving general health. Okay. No one treatment works for all symptoms, but trying a variety of treatment strategies.
Mm-hmm.
That was a struggle for some reason.
Yes.
Can have a cumulative effect.
Yes. Okay. With that, if I can focus right, your body can learn to absorb a lot of pain. I do not take painkillers, prescription. I will take Tylenol, and I will take the medicine that is prescribed by doctor, but to me to just walk in and say, I'd like some Vicodin. No, thank you. And that's because addiction runs in my family. And I'm not going to over-medicate myself and hurt myself. So there are strategies, like he said, there are strategies. A lot of deep breathing. A lot of asking for your legs rubbed. Meditation. Acupuncture. Heat therapy, yoga, anything that clears your mind, because your mind will get cloudy. I'm to the point now that I speak weird. I'll remember what I'm saying. When I talk to somebody, I can't just look at somebody anymore. I have to look to the right to think. Look to the left to think. If I look at someone, I'll forget what I'm saying. And I tell people, pardon me if I gotta look away. I'm trying to be in a cognitive place where I can hold a conversation. That's like even now, I'm like looking off to the side because I want to really focus on my words and say what I need to say. So YouTube and getting on here and talking to you, even though you can't see the struggles sometimes, is one of the best therapies I can do. And I tell my family and I tell friends, if I'm struggling and you know what I'm trying to say, don't say it for me. Let me just have a moment to think about it. Because cognitive functions they can be affected, and boy oh boy can they ever be. And I can be in the part where I'm thinking about something and I don't want to forget it, and I'll just wait and I'll wait. And then it seems like somebody will take a breath and I'm like, oh, I gotta tell you this before I forget. Okay, now go back to what you're saying. And everybody knows that I do that now because I will forget. I'm not going to hide it. I'm not going to sugarcoat it. My cognitive functions suck, boys and girls. So, sometimes I need a little grace. If I'm just completely train wrecking it. It's okay, because I'm trying. I haven't given up and said, that's it, I'm done. I keep fighting every day. Yes. Yes. I'm ready for you.
Oh, you ready to continue?
Yes.
So
you know, I just have to have the moments, just like we're speaking. I got to get my moments across and my thoughts across before I forget them.
Well, some of those we're getting ready to cover.
Okay.
We're going to be into those.
Okay.
So medications.
Yes.
Pain relievers.
Yeah.
Over-the-counter pain relievers such as Tylenol, ibuprofen, like Advil, Motrin, IB, and others, or naproxen sodium.
Yes.
Aleve,
That's
others
Aleve.
that may be opioid.
That's where you're getting in.
I just said
Opioid. That is where you're starting to get into prescription medications. Is opioids.
Because they can lead to significant side effects.
Yes.
And dependence, and will worsen the pain over time.
Yes, because your body can't absorb it naturally, and it'll get to the point where it doesn't work for you. You have to keep more and keep doing more, and then you're addicted, and then you're hurting yourself.
So
that's
now
why
we're
I don't
on
do
antidepressants.
it. Okay, there's a lot of antidepressants. Duloxetine.
There you go.
Yes, I take that.
Basically Cymbalta.
Yes, and I take that. They have found wonderful research that not only does it help the fibro brain fight the depression, it also helps with the nerve endings for fibromyalgia patients. So, it does a 2-for-1. So even people that do not have depression at all, and thank goodness you don't, will still get prescribed that, because the help for the nerve endings is amazing. Because I've taken other stuff, it quit working, but so far this is working great. Okay, yes, duloxetine.
So your other one,
yes,
is your old favorite.
Yes,
the very expensive one.
Oh, Savella.
Yeah, but I ain't pronouncing the other word for it.
Savella. I loved Savella.
But what's that word? Because that name's the one in front of Savella.
Milnacipran. Okay. Milnacipran. I have to break it up into 4.
I wasn't even going to try it.
That is Savella. And that started out working wonderful for me. I loved it. The only problem is, it was like $400 for 3 months. And I mean, my body was starting to get used to it, because with fibromyalgia, that happens. You will take a medication, and after you take it a little bit, your body goes, nope, I'm tired of that drug. I want something else. So I took that for a while, and then it kind of quit working. So then the Cymbalta come in, because it's a lot cheaper. I took Lyrica. Lyrica has side effects. They all do. But Lyrica made my heart get enlarged. And I would have cardiac moments, phantom cardiac moments, where I just knew I was having a heart attack. And before they would put the EKG on me, I would tell them what I was feeling, and they're like, oh my goodness, and they would rush me back to a room, and they go, no, your EKG is fine. It's just a fibro thing. And you'll hear that phrase a lot. It's just a fibromyalgia thing. Just keep coming back, because we never know which one could actually be real. My heart was enlarged. I had heart damage from it. So I would roll my eyes and say, okay, I gotta go to ER, or I gotta go to urgent care because I'm having chest pain. Not that would happen to everybody. That just happened to me. Was it a fluke? I don't know. It doesn't happen to everybody. Obviously, it's still on the market, so it can't be horrible. So yeah, you just can't be afraid to communicate to your doctor. No, they're not going to get tired of you, and they're not going to think you're a pain in the butt. Just be real. communicate. Tell them what's working, what's not. Only way I found out is because I went to the doctor, my old doctor, and I'm like, I'm having these chest pains, and it's like horrible. And she pushed on my sternum, and I screamed. And that's how she found out that I had a problem with Lyrica. So, and I would always just hide it and go, oh, it's nothing. It's nothing. I go on and getting checked out, and nothing's happening. It's fine. I'm not going to say nothing. Well, then she got my ER report, and she's like, okay, how many of these do you have? Waiting for me to give her the answer she wanted to hear because she already knew. So I come clean, and that's when she pushed on me, and yeah, I was on Savella after that until I got the dreaded pandemic, the long version, and all of my medicines quit working. So we had to scramble to find stuff that worked, and Cymbalta worked. Will something be found 3 months down the road? Well, when this stops working, we'll figure it out. But until then, this is working good. We're at a place where there's nothing else they can do. Yes. So there's that. Yes. I took Savella for a while, and at the beginning, it was absolutely glorious. Keep on going, Tom. You're doing a great job. He's being very useful today.
Well, at least that happens every once in a while.
Yeah.
Also, besides those, your doctor may prescribe
Amitriptyline.
There you go. Or the muscle relaxant.
Muscle relaxer. Muscle relaxer.
Finish it. Muscle relaxant.
Yes.
Cyclobenzaprine.
Yeah.
To help promote sleep.
Yes. I take amitriptyline for the trigeminal nerve in my face.
I take it for sleep.
Yes, but I take it for because that's what they're finding out. That these medicines can work for more than one thing. So don't be like, oh, I'm gonna have to be put on a mental health medicine. I'm taking one, and what I'm taking, I don't have. When they first, I will be completely honest, they first came to me and said, we only have one more medication that we can use for you, but it works good, but people are afraid to take it because what it treats. Like, well, I've never been one to be afraid of medication, so tell me what it is. And they said, we're going to put you on Seroquel to help you sleep. I said, okay. Well, what is that for? That I should be like hesitant to take it? Well, it helps with people's sleep. But it also is for people with bipolar and schizophrenia. And you don't have any of those. But it's just like Cymbalta. It can treat different things. So I looked at the doctor and I said, give it to me. Because it treats different things. And why be afraid to take something that could help you sleep? So I took it. And then I wasn't having anything really sleep-wise happening. So he said, okay, well, let's take you off and try this very last thing. I found it doing some research. There's a 50-50% chance it could work. I said, okay. So they took me off of this and they put me on something else. It did nothing. So I went back to the doctor and I said, this didn't work. At least the other medicine, I was able to shut the brain down. And let me explain what that means in a minute. I was able to shut my brain down enough to fall asleep. Because what would happen would be, I'd go to sleep and I'd be like, I could diamond paint, so I'm not falling asleep. I could watch YouTube because I'm not falling asleep and I'm bored just laying here. Well, when I took that, my brain didn't say, I can do this, or I can do this, or I can do this that much. It slowed it down a little bit to where I could relax enough to go to sleep. And I told the doctor, I'm like, I just don't understand how that medicine can help, because I'm not hearing voices and my mood's not changing. So how does this help? And then I tried to do it as tastefully as possible because, I don't want to offend anybody. I'm just wanting to really see what makes this medicine work. Because you got to think about what you're taking and why you're taking it and what side effects it can do and what it's for. And, you need to know what your medicine you're taking. So I had questions, and he was able to give me really good answers. And I had the concern of, will this cause mental illness? And he said, no, it won't. So don't worry about that. I have that legitimate fear. Could this lead to something else? Because, fibromyalgia don't play. It's pretty serious when it comes to mental cognitive function. And he guaranteed that it would not hurt anything. So yes, I'm taking medicines that other people use for mental health. Am I ashamed of that? No. Because it's helping me. There's no shame in this fibromyalgia game. My phone is blowing up. There is no shame in this game. I do have anxiety. I do have depression. And when I say I have severe PTSD, there's not a night that I don't have nightmares. But that's part of this game. Yeah. So, anything else, sir, that we need to discuss about fibromyalgia?
Anti-seizure drugs.
Okay, anti-seizure drugs.
Medications designed to treat
epilepsy
are often useful to reducing certain types of pain. Gabapentin,
I take that.
sometimes helpful in reducing fibro symptoms, while pregabalin,
yeah, that's
Lyrica,
it's Lyrica.
was the first drug approved by the FDA to treat fibro.
Yes. Gabapentin or Neurontin, depends on what you take. Normally, people will get 200-300 milligrams a day, twice a day, 3 times a day. I take 2,400 milligrams a day because I am severe. I'm in the severe category, boys and girls. That is why I decided to speak up and be a cheerleader, to rah-rah people, to get the word out. 3,200 is what you can take. But that will cause heart attacks and heart issues that I've had enough heart issues already. So the doctor and I are kind of like, no, you cannot go that high. And I agreed. So I'm stuck at this forever, or until we have a cure. The whole reason for this is to bring awareness. We've got famous people that have stepped up, thank goodness. Morgan Freeman, Stevie Nicks, Lady Gaga, and we need more. So if you have fibromyalgia and you've got a YouTube page, this is the month for us to stand on our soapbox. We need more awareness for this. We need a cure for this. Because not only is it just fibromyalgia, but the long list of what I call the evil stepsisters of the side effects that we have. They're long, and it's not easy. So this month is the cause to create awareness. Don't be ashamed. Go to the doctor. If you've got it, don't be ashamed to talk about it. Wear purple with pride if you have it. If you are our ally, you have someone that has this, wear it for them. I seen a wonderful shirt one time that said, I don't have fibromyalgia, but someone who loves me does, and I wear it for them. If you find that shirt and you have someone that you're an ally for, get that shirt and wear it for this month and every May. May 12th is our day. They used to.
Sunday, Mother's Day.
Oh, is it Mother's Day?
It is Mother's Day.
Okay, all right. So Mother's Day, I will be wearing purple with pride. But used to, I don't know now or this year, because things change every year. But on Fibromyalgia Awareness Day, they used to color Niagara Falls purple for us. Yes. Okay, yes. Anything else you want to say?
You can scan through the rest of that and you can pick what you want.
Well, we can do it for the next video.
Well, there's only self-care and all that, so
okay.
I mean, you can pick them through.
Okay, therapies.
All that.
The different therapies that you can include to help you is physical therapy. A physical therapist can teach you exercises that will improve strength, flexibility, and stamina. Go and see a physical therapist. I still, to this day, do some of the same exercises to straighten. Because you know what the weirdest thing is? There's times, especially when it bugs your spine, that twisting or bending is something that's really hard to do. So just simple, basic exercises. Water-based exercises. Yes. If you have fibromyalgia, go to a gym that has water aerobics. Or even arthritis water exercises. Go to the classes. Don't be ashamed. And you may not be able to do much at the beginning, but you'll get that stamina up. When I was first diagnosed, my doctor, they had water aerobics available, and I didn't do it because I was like, oh, I don't want to do it. I'm like I was really heavy at that point. I was 400 pounds. And I was unsure. Well, then I moved to a different doctor. And she said, I am going to send you to our gym that's related to doctors. And you're going to get water physical therapy first. And then I want you in that pool. And I told her my fears, and she said, no. Do one class for me. And I did. And I ended up doing 13 classes a week. I lost 100 pounds. Because I learned to get over what I looked like in my swimsuit. I found swim shorts. I found swim tops, overtops. I met people. They became friends. And they were so proud of me. Every class, I had a group of women. Yes, you did it. And then I moved to here. And I had to wait till after pulmonary therapy. I did it for a while, and then the long COVID hit, and I had to stop. And I did the pulmonary therapy. It worked wonders. Got off the cane, and now I'm ready to get back in the water. Now we just got to get him ready. So, occupational therapy, yes, if you work. I worked at first until it got too bad where I couldn't. They will teach you how to literally work. I was working at the library, and I would have to lift 50-pound crates to check in books. They taught me. I explained what I did. They set it up, and I literally went to occupational therapy, and they taught me how to do my job safely. Occupational therapy is amazing. Just do it. Get the help. There's help out there. And finally, counseling. Let me tell you, talking to people helps. I had counselors. I had therapy. And then when the dreaded C happened, I did online. There's plenty of options out there. And I'm sorry I'm putting Tom to sleep. He keeps yawning on me. But there are a lot of people out there that's willing to help you. Even if it's online. Even if it's just watching so many YouTube videos that counselors are making. Get the help you need. Find people that are in your circle that really helps you. And if you don't have anybody in your circle, I'm here. You just have to message me, and I will be in your circle. And I will be proud to do it. So, with that, it has been an hour and 12 minutes.
You're not boring me. I hit the time of day where I just get really tired.
So, this section is done. You got to see me do some very boring color blocking. But there's a lot of it in this. So, and I wanted to, this is only a 30 by 40, so I want to show you guys a lot of it for this month. And I'm just doing bite-sized little pieces. So, obviously I'm not going to be able to do the whole month, this canvas. But, because it's just not big enough. But I want to do, I want to do all of it. It's not going to be the whole month. So I've also got the queen to work on as well. So I will.
Speaking of her, do you want to see somebody that looks really good in purple?
In a minute. I'll talk about her in a minute. Where was I at? Sometimes the choo-choo train stops. But I do have the queen to finish. I have a couple of rows left of her, which I will do. And yes, Tom is right. There is a beautiful woman that's in the news right now that looks so beautiful in person. And that is the Princess of Wales, Catherine.
Colored purple, like a plum purple.
And may I say, I haven't really said too much about this, but can we all say a prayer or lift her up, send good thoughts, positive thoughts, healing thoughts to her, because she is an amazing woman, a very public figure going through cancer.
She has a new title too.
Yes, she does. And the king awarded her with a new title. And it's something about Order of the Companions of Honor, which basically means she is a companion of someone, of William. So that's why she got that. But yes, that was announced about a week or so ago. And I was so happy that the king absolutely adores her. And also too, can we send up love and prayers to King Charles. Um, no matter what good or bad you feel, because, some people feel certain ways. No one ever deserves cancer. Good, bad, or indifferent. No one ever deserves cancer. So much love from the beautiful train wrecks, the diamond painting Edwards family, to you, Charles, and to you, Catherine. And I hope your treatments heal you and bring love to your lives. To know the world loves you.
She is the first royal family member to be appointed to
Yes.
that in the order's 107-year
Yes,
history.
because it's usually like people that help, like famous people or
Oh, yeah.
people that are involved in charities. No, this isn't something. This is very unusual that he granted her. It's for people with environmental help, like help, not environmental help, but people who help the environment and um, people with science. So this is a very rare thing, but she is very well knowledged about art and photography. So it is well deserved. This isn't just because, oh, well, she's my daughter in law and I'm going to say this just because I can, or she's going through cancer. No, she earned that with beautiful garden that she created for the Chelsea flower show. She's done that a couple times. I think that's it. If anybody knows for sure, but I think that's what it's called. And then her love of art from college and photography. So she is very well deserving of this honor. So, so yeah, with that, I'm gonna let you go because we are at an hour and 17 minutes, or as I say, a minute 17. I said that one day and it stuck.
I apologize for the interruptions.
Yes, but that's okay. He's just kind of trying to keep me on my game, I guess, to make sure I'm clear thinking today, which has been a struggle. So it's kind of like mind exercise for me.
I didn't know this came out. I'm a week behind. I'm just
Yes.
finding this out.
He is not really a royal watcher like I'm a royal watcher.
I follow him on Facebook and stuff, but I looked at your phone. You got it come across.
Oh yeah, I follow it because I follow.
I mean, I do try to keep up on different social medias, but I did. The more I read, I found some other interesting things too. So I'm like,
my phone has got a lot of fibromyalgia awareness, diabetes awareness, royal family, cancer, anything that's ever been really important in my life, or people in my life that's had it, or friends that I know who have had it, or their parents have had it. I try to keep my finger on that so I can be knowledgeable. And it's important that if you have family or friends that are going through something, or their parents have gone through something, that you can say, hey, I read this. Have you seen this? You need to check this out. Because just because you have it doesn't mean that you know everything about it. There's things I'm still learning, and people will go, oh, I have this, and can you imagine I just seen this? Oh, wait a minute, let me get my phone out. I want this site. So yeah, it's never bad to learn and to grow, because when you have something that's non-curable and treatments are slim and there's really no hope in sight of treatment, anything you learn can be used for growth and another way to make you better. So with that, I'm going to try again. Big hugs and kisses. I love you so very much, and I'm so thankful for each and every one of you. And if you're going through something and you ever need anything, just message. You will have an ally. And whatever it is. Bye. Say bye, Tom.
bye, Tom.